Good afternoon, everyone, and welcome to our 10th IAFC coronavirus webinar. My name is Gary Ludwig. I'm honored to serve as President and Chairman of the Board for the International Association of Fire Chiefs. We conduct these webinars every Monday at 4 p.m., but we will not be here next week because of Memorial Day. However, we invite you to return back on June 1st when we'll have the latest information and new guest speakers. I want to thank everyone who is joining us on this webinar either directly or later when you'll be listening to the recording. The IAFC represents the leadership of over 1.2 million firefighters and over 30,000 fire departments in the United States. We also have members in Canada and other countries around the world. Today we'll hear from our Coronavirus Task Force Chair, which is John Sinclair, Chief John Sinclair. Our Economic Task Force Chair is also Steve Pegram. Him and his task force are working very diligently on your behalf, providing us with the latest information. You'll hear from Chief Sinclair today. You also will hear from Dr. Jim Augustine, who is our medical expert, who also sits on our Coronavirus Task Force, and he will give you the latest medical information, which I know changes not only daily, but almost hourly. Also on today is our Government Affairs Director, Ken LaSala, and he'll have a lot to talk about as the House Bill, the HEROES Act, was passed by the House last Friday evening. And then today our guest speaker is Deputy Fire Chief Rich Elliott. He's a Wildland Ops Section Chief and member of the Wildland Fire Policy Committee from the IAFC. He also hails from the Kittitas Valley Fire Rescue Department in Washington State. Rich will be discussing the upcoming wildland season and the challenges that the pandemic brings to wildland crews and base camp operations. And we're already starting to see that. I know Florida has been hit with a lot of wildland fires already that have been in the news. But before we begin, I just want to update everybody on the latest numbers of deaths in our profession related to the COVID-19. As of last Friday, there were 50 members in our profession, and we suspect 2 more over the weekend. We're trying to confirm that, who have died from the coronavirus. These are either firefighters and our EMS people, who are just EMS only. Again, our thoughts and prayers go out to the families of our brothers and sisters who have been lost in this battle. And we pray that God wraps their arms around them and comforts them during this trying time. With that said, I'm now going to turn it over to our Coronavirus Task Force Chair, which is Chief John Sinclair. And so, Chief, you now have the floor.
Thank you, President Ludwig, and welcome to all of our listeners. I just have 2 different messages for the group today. As we have talked about in webinars past, we continue to work the PPE issue. There are a number of signs that this is getting slightly better. The issue to make sure of is that you are getting your PPE from a trusted source. There are states and localities that have been built and to the tune of millions of dollars. And so just make sure that your PPE is coming from a reputable source. And if they're asking you to pay upfront, that's a pretty good indication that this is not a reliable resource. As we look at people opening back up, there's going to continue to be a push on the need for PPE as people who are traditionally not asked to do PPE. A lot of folks are going to be using cloth masks. Certain states, as part of their reopening, are going to require cloth or surgical masks for people to be wearing out in the community. So that's going to be a drawdown for us. And just know that as we look to the fall, we're going to see probably a resurgence in PPE needs. So you're going to need to plan for that. The other thing is that as we're beginning to see this run its course in certain areas and it's beginning to diminish, it is also hotspotting in other places. And so that's where the contract tracing teams are coming in state by state, and they're beginning to get a handle on this And that's going to be key to reopening up the states, is to make sure that they've got a heavy contract tracing team that is available to us. In those states that aren't opening up fast enough for certain members of the population, we're beginning to see growing numbers of civil and increasingly uncivil disobedience. And it is important for us to know what our role is if a significant event breaks out. So I'm encouraging all fire chiefs to go out and have a conversation with your colleagues in law enforcement, whether that's a deputy sheriff or a sheriff or a police chief. However it is that you do local law enforcement, I would encourage the chiefs to go out and sit down and at a socially distanced appropriate place, but have a conversation with your police chief or your sheriff to find out what role you need to be in. It is going to be a trying couple of months as we begin to open up and see where the hot spots are going to be. But I think that as we open up, we're going to see a lot of stellar information coming out of the fire service as they're finding new ways to innovate, and we'll continue to report on that. So with that, I will turn it back to you, Mr. President.
Thank you, John, for that update. I appreciate it, and appreciate all the work you do as chair of our task force. You are doing outstanding work there, and I sincerely appreciate it. With that said, I'm now going to introduce our medical expert, Dr. Jim Augustine. And again, Jim always has wonderful information, timely information. And again, Jim, I appreciate you sitting on our coronavirus task force and providing that medical guidance that we so sorely need during a crisis like this. So again, with that said, Jim, I now turn the floor over to you.
It is my honor to serve with all of you and with the entire service. And we have done a great deal to not only flatten the curve but mitigate other community aspects of coronavirus as we have moved through. We have more work to do, though. So what are fire chiefs and fire leaders going to be looking at over the coming months as we move through this operations phase of this incident, and then turn our attention to logistics, finance, and planning? First is our own local volumes and what is happening. Let me share with you some data that I just got from the state of Georgia comparing April 2019 to 2020. So April to April, our 911 EMS calls were down 13%. Our transports were down 18%. Our out-of-hospital cardiac arrest numbers were up 25%. And our dead on arrival calls were up by 50%. Our motor vehicle crashes down 55% year versus year. This indicates that there's significant impact of the coronavirus, not only on coronavirus patients, but on our routine operations. You are going to need to watch over the next 90 days as we move into the reopening phase. In Georgia, as you know, we had a governor who worked to reopen a little quicker. Nonetheless, we are continuing to see our hospitalizations, use of ventilators, and deaths going down despite the reopening. Now, there's weeks to go as we go through these stages, but all of you should be looking at your volumes, the development of coronavirus-related hospitalizations and deaths, and then your routine operations as we move into summer weather times and the weather events that occur. Another important aspect of current operations is to look at sites where deaths and serious illness are still occurring. Those are in our senior care facilities, in our jails and prisons, and in other congregate settings. Those may be tracked by a state and local system. I just came off of a call where we're trying to set up a local system that hasn't been in place before to look at where our deaths are still occurring, which is in nursing homes. And fire EMS involvement in those will need to occur because public health is not as familiar with the congregate settings, very honestly, as fire and EMS are. So those are all developments over the next 90 days that you may want to be watching. Next slide. So this is an important slide. A lot of questions in the last week from fire chiefs on this. So our usual death pattern shows peaks in the winter months. Over the first 4 months of this year, our average number of deaths were going down significantly, and that decrease related to our abrupt ending of many of the elective procedures that take place, but much more importantly, the social distancing, which reduced overall infections and motor vehicle crashes and other forms of trauma. As of the last 3 to 6 weeks, and in particular in some of our the number of deaths has moved up, and that relates to the cardiac deaths and cardiac arrests from people avoiding cardiac care and routine follow-up with physicians and specialists. Next slide. Our staff still critically important. Mental health, especially in this EMS week, is very important. So I ask that you take a look at the mental health needs of your staff and kind of moving ahead, thinking of potential times when breaks and vacations may need to occur over the next several months. And then I believe we will be looking at a return to some normalization of operations, including less use of gowns, particularly in the summer months, and masks coming off in the stations. That may allow, again, a little less stress on individuals. And I know when I'm working, whether it's in the fire station or in the emergency department, adding that mask to my face long term is really very, very difficult, particularly in hot and humid conditions. Next slide. Testing, more options are coming. There's much more volume coming and a greater speed of the testing for the antigens. We do know that this testing is working. You are hearing headlines about certain tests that may not be as accurate as we would like them. Remember, all tests that we would like to do, we would like to be 100% sensitive and 100% specific. Essentially, no test is ever 100 and 100. And in particular, what is disturbing with this when it comes to results is if somebody has coronavirus, but the test shows that it's negative. That's a dangerous time for both the patient and for the people around them. We need to move to where we can get 100% sensitive tests that pick up every infection as it is occurring. If it is not specific, if it's picking up old coronaviruses when we test for it, that's a little less dangerous. And so we're looking for very sensitive tests, even if we have to give up a little bit on specificity. Next slide. Our antibody testing, which will have a variety of names, will be called serology testing or blood testing. Some of it can be done with a finger stick. Some of it has to be done with a blood draw. We're working through, and in particular, 2 sets of tests, one being developed at Emory, one being developed at Rutgers in New Jersey, are coming to be the gold standard of doing tests. When those tests are available, we will get to high levels of specificity of the test itself for antibodies, and eventually we will come to better use of these antibody tests to figure out how wide the infection rate has been over the first 4 months of this year, and then eventually how antibodies will tell us whether us as individuals can get this infection in the future or not. As yet, we do not have that information. Next slide. Our planning for the fall has to occur taking into account the potential for coronavirus, influenza, and other diseases that come in the winter months. Your planning needs to be the same. What is different about this fall versus what we have been through this winter and spring is that we have already developed our basic processes. We will work to hone and improve those. This fall, we will have more PPE locally sourced, meaning North American sourced personal protective equipment, in particular, masks, gloves, and gowns. Those have been the weak elements. Masks have been the weakest element, and you should be looking this fall for PPE that includes a comfortable fitting on the face, but replaceable cartridges or filter pieces that will serve the N95 or higher function for that mask. What has been missing in masks to date has been comfort for long-term wear, durability, and the ability to trap small particles without making it impossible for the person to breathe. Therefore, the improvements that are occurring in mask design are likely to make it much better for healthcare workers and for public safety personnel, in particular to use for longer periods of time. Another process for this winter, hospital groups in metropolitan areas are looking to designate certain hospitals as either hot or cold hospitals. Hot meaning preferred receiving hospitals for coronavirus positive patients, with a setup that includes staff that can manage those patients most efficiently and safely, and where everything from visitation policy, ventilation systems, et cetera, can be set up specifically to deal with these infectious patients. There may be other hospitals in your community that are designated cold, meaning they will not be there to manage coronavirus cases. They will be there to manage the day-to-day business, strokes, heart attacks, fractured hips, trauma, delivering babies, etc. With rapid available testing, it may be that every person that comes into that hospital, every day they come into that hospital, or every day they stay in that hospital, is tested for coronavirus. If that test should switch and turn positive, that staff member would not be allowed to work, or that patient would be transferred to a hot hospital. I hope you understand that, and you as public safety leaders and fire EMS will be working with your hospitals if they choose to develop this process. Obviously, if we got to overwhelming numbers of coronavirus cases this fall, then we might see a switch over to where all hospitals would have to convert to being hot hospitals. But hopefully this fall we could go to a process where intentionally we would keep some hospitals cold and use some hospitals as hot hospitals. You're familiar with this. We use this every day when it comes to serious hazmat patients and events. We don't want to dirty up every hospital in a community with hazmat contaminated patients. We convert to a process where preferentially they go to 1 or 2 or 3 hospitals. Their management is expedited and becomes more expert as we take victims there, and then we don't contaminate every hospital in a region or in a city. You need to be involved in the planning for that, and hospital system leaders should be sitting with you to figure out how to implement it. Next slide. The Center for Infectious Disease Research and Policy has made recommendations. I put these in again because these are the recommendations that come and are used by your public information and government officials. It's important that we get our public prepared, and then we as fire service leaders get our firefighters and EMS personnel prepared for a disease that may be here for another year or two. Vaccine work is going on and is being expedited as quickly and safely as they can. But in the meantime, we may continue to have resurgence. There was, for example, bad news from Brazil. So the South American drift of this coronavirus is bad news. If that virus moves into the southern hemisphere and then can move back north when cold weather returns here, that will result in this thing cycling, and that is what we did not want to happen. It would have been very good if we'd have seen very little drift of the coronavirus into the southern hemisphere. There's also significant exchange of people that occurs between South America and North America. And for example, in South Florida, where a lot of Brazilian people have residences or second residences, there's the potential that the traveling of those people could cause a recurrence of issues in South Florida and other places where South American people go. Next slide. Planning for future wave then is our responsibility, and it's our responsibility now. Flu vaccines, moving into coronavirus vaccines, will likely involve members of the fire EMS community. In our state, we're asking whether that's a paramedic level function, an intermediate or advanced level function, or even an EMT basic level of function to be involved in the vaccination programs that we likely will have to assist with this fall and into the future. And eventually, when we have billions of doses of vaccine ready to administer, likely that public people will need to be involved. In particular, for members of the community that don't have good access to health care. That's our specialty area within Fire EMS and our commitment to our communities. I will remain on the call for the rest of the time and be glad to answer any questions. And please send emails to me if there's further questions that come up about the health-related aspects of the current coronavirus. Chief Sinclair and Chief Ludwig, thank you very much for the opportunity.
Well, thank you, Jim. Before you sign off here, or before I move on to the next speaker, can you give those numbers that you gave earlier? I keep hearing from people all over the country about, of course, the run volume's down, but the cardiac arrest rate, which is usually less than 1%, is hovering 12, 13% of the run volume. What were your numbers again there?
Yeah, I gave the state of Georgia, the overall call volume and transports were down 18%. The out-of-hospital cardiac arrest volumes were up 25%.
25%, wow, okay.
And the DOA numbers were up 50%. So, Chief, if you take a reduced number of calls overall, but increase the acuity, you may get to very high numbers of out-of-hospital cardiac arrests or deaths. And we know in the hard-hit COVID communities, so this is one of the studies the Eagle's doing right now for each of the major metropolitan areas, looking at our combination of cardiac arrests plus deaths to see if it correlates with the presence of coronavirus in the community. Yes, sir.
Let me offer another suggestion is that, or another hypothesis, that people are not seeking medical care. They're not getting cancer screenings, or they might have some heart issues. They're not able to get into their doctor. Let's add up all those issues. And is that a possibility that these cardiac arrest events are up in these communities? It
certainly is. That is no doubt a contributor. I know in taking care of patients myself, the family, when we deal with the death, said, hey, he was due for his appointment. He was due for his pacemaker update. He was due for testing in the cardiac cath lab. He refused to do it. He couldn't do it. His doctor was not available. It was not safe to come in the hospital. And now he is dead. And Chief, there's no doubt a death penalty coming ahead for people who didn't get cancer screening, didn't have their preventive care, let their blood pressure or sugars or whatever get out of control. That is no doubt a penalty we will incur in the coming months to years. So an impact on the entire healthcare system, and that is our opportunity to plan ahead into the fall so there's less impact and less long-term penalty.
Exactly, Jim. I just wonder if somebody will ever be able to compile all the numbers to see what that number is of how many that have died as a result of not getting the health care that was needed so desperately. So, but again, great information, Jim, and thank you again. Just very informative and so timely always. So thank you so much.
Thank you, Chief.
With that said, now I'm going to turn it over to our Director of Governmental Affairs at the IAFC, and that's Ken LaSala. And again, I'm sure Ken will have much to speak about as the HEROES Act came out of the House, was passed by the House last Friday. And again, him and his staff do just outstanding work on behalf of the IAFC. So Ken, you now have the floor.
Thanks, Chief Ludwig. Thanks for those kind words. We really appreciate it. Going forward, today I'm going to spend a couple of minutes first talking about the HEROES Act. That passed the House on Friday night. It's Bill HR 6800. And first, I'd like to thank everybody who's tuning in today who was kind enough to use our Legislative Action Center. For the past couple of weeks, we've been really working hard, both in the media, grassroots meetings on the Hill, to educate members of Congress about the needs of the fire and emergency service in responding to COVID-19. So we, appreciate all your hard work, and as you can see, it paid off in some cases. The HEROES Act, first, to address one thing, the IAFC is supportive of the public safety provisions of the HEROES Act, specifically those affecting the fire and emergency services. The bill itself is 1,800 pages long. The IAFC has not endorsed all 1,800 pages. We've been focused just on the public safety provisions, which I'll be talking about today. First off, as you probably know, the House bill includes $500 million each for the AFG, the fire grant program, and then $500 million for the SAFER grant program. It also includes a number of waivers to requirements to the programs. And just to kind of make things clear, we're basically talking about 3 buckets of money just for the AFG program. So for AFG in December, Congress appropriated $355 million. And then they just appropriated and passed as part of the CARES Act an extra $100 million, which was focused on COVID-19 response. That's for N95 masks, personal protective equipment, sanitizing agents, things like that. And now with the HEROES Act, that would include an extra $500 million if it passes the Senate and the President signs it. So in terms of some of the waivers for the AFG program for both the fiscal year 2020 money, that's the $355 million, and the $100 million in the CARE Act, the bill proposes waiving both the local match requirements and the maintenance of expenditure funds. The maintenance of expenditure funds, you all may remember, is the fact that a jurisdiction cannot cut their budget by 80% of the year before while they're receiving fire grants. So again, for the the slide says for both the CARES Act money and then also for the fiscal year 2020 funds, that would be the $355 million, it will waive the local cost share and maintenance of expenditure requirements. For the new $500 million, as the slide shows, Congress actually had even broader waivers. They waived the local cost share, the maximum amount, the maintenance of expenditure requirements, and then also they waive the peer review, so that will make it faster for the agency to get money out the door to local jurisdictions. And then also inside the AFG statute, there's a limitation so that volunteer departments can only receive 25%, career departments can only receive 25% of the appropriate funds, and combination departments can only receive 25% of the appropriate funds, And then there's roughly like a 2 to 3% ceiling on how much funding can go to nonprofit EMS. What the HEROES Act would do for that $500 million would be to waive those requirements. So that's, at least in terms of the AFG program, what some of the changes are under the HEROES Act. For the SAFER grant program, again, for fiscal year 2020, Congress appropriated $355 million. And then as part of the HEROES Act, Congress is, the House is now recommending appropriating an extra $500 million. To this, again, there's been some requirements have been waived, both for the fiscal year 2020 money and then for the new SAFER money. What this is supposed to do is actually help fire departments retain and rehire firefighters. As we discussed last week, the IFC projects that as many as 30,000 firefighters could be laid off next year. So this is an attempt by Congress to create situations and give incentives to fire departments to, instead of laying people off, use federal grants to be able to retain and rehire recently laid off firefighters. So again, what this would do would be to waive the maximum amount of salary that you can pay for a career firefighter. Again, it would waive the peer review panels, and then also it would do things like make it easier. It would waive the requirement that you actually have to use the SAFER monies to hire new firefighters. So this would allow fire departments to retain and rehire firefighters. So that's the big thing with the HEROES Act in terms of AFG and SAFER. Moving on to the next slide is some of the other provisions. For the volunteers, there's actually language in the bill which would extend the exclusion of any state or local property tax benefits and up to $600 and other benefits for volunteer fire and EMS from federal taxation. So for this year, there's that protection as part of the Volunteer Responder Incentive Protection Act for fiscal year 2020. Congress has set in some exemptions for state and local benefits for volunteer fire and EMS. And what this bill would be to make them permanent. It also includes a $500 deduction for first responders for training, tuition, and uniforms. It creates a HEROES fund, which actually would create basically hazardous duty pay for essential workers like fire and EMS. That would equal to roughly about a $13 per hour pay increase for fire and EMS. It would be up to $10,000. And actually, the way the bill is written, it looks like that money would not end up affecting people's taxes. The bill also would meet a long-term IFC objective by repealing the requirement that the FCC auction the T-band. That's the 470 to 512 megahertz band that 11 major metro areas use for their interoperable communications. And then the bill would also clarify that the families of first responders who either die or become disabled from COVID-19 would be eligible for the Public Safety Officers Benefits Program. So these are some of the major provisions inside the HR 6800. We actually have roughly about a 2-page summary of the bill on our website. So if you need more details, feel free to go there and take a look at it. And we continue to try to educate our senators about the needs of the fire and emergency service regarding COVID-19. As Chief Ludwig mentioned, the bill passed on Friday. The Senate at this point has no plans to bring up HR 6800. And in fact, probably they won't really start talking about this bill until June. So now is a really great time to reach out to your senators and explain them about your needs. And, hopefully we can at least get these public safety provisions included in whatever passes the Senate. Moving on to some other legislation that passed recently. On Thursday, the Senate actually passed legislation that would clarify the PSOB eligibility for the families of COVID-19 line of duty deaths and disabilities. And I talked about this briefly last week, but basically in there's the requirements. So the officer has to engage in line of duty action between January 1st, 2020 and December 31st, 2021. The officer has to become diagnosed with COVID-19 or display evidence of the disease, symptoms, within 45 days of the last time that the public safety officer was on duty. And then the officer has to have COVID-19 or complications therefrom at the time of death. So the bill passed the Senate on May 14th. It's now sitting over at the House. And of course, the House has their own COVID-19 PSOB legislation, which they attached to the HEROES Act. So at this point, we're trying to work with the House Judiciary Committee to find out what their next steps will be and whether or not they'll just pass S3607 or they'll wait until the Senate figures out what's doing with the HEROES Act. So I guess stay tuned. Moving on to talk about some grant programs. There was some big news on late Thursday night / Friday morning. DHS has now extended the application period for the fiscal year 2019 SAFER grants. They also waived the cost share, the fact that you couldn't use federal money to supplant local funds. They got rid of the cost limit for the salary of firefighters. And then also, we talked about the 80%, the fact that a fire department receiving SAFER funds cannot cut their budget beneath 80%. That got waived too, or beneath 20%, so they have to keep 80% of their funding from the year before. But basically, all those were waived. So if you're working on your SAFER grant application period, or you're working on your SAFER grant application, The good news is you don't have to ask for an economic hardship waiver. All that's going to be programmed into the system, and that should make it easier for you to apply for your SAFER grants. And again, that's the fiscal year 2019 funding, and that's now being extended to May 27th. Regarding the fire prevention and safety grants, that application period is still running until May 29th. And I've just included on there a recent blog that we put together about how fire departments can get paid by HHS for some of their COVID-19 reimbursement programs. For those of you who missed it, Chief Lawrence gave a really great presentation last Monday. So if you have any questions about that, please feel free to go back and review that webinar. And for about 10 or 15 minutes, you'll learn a lot about the whole HHS reimbursement system. So that's my report. Thanks again, Chief Ludwig, for your time today and for the opportunity to present here. And look forward to, seeing what Congress does in the next 2 weeks.
All right. Well, thank you, Ken. And again, I just want to extend our thanks on behalf of all the IFC members and the whole fire service as a whole, what you and your staff are doing up on Capitol Hill to represent us for advocacy. There was a period of time, I think Ken and I were on multiple calls every day with somebody up on the Hill, talking to either a Senate or a House Appropriations Committee or the White House, or talking to some undersecretary from some different department. It was a plethora of calls, and I know it takes a lot to set up all those calls. And again, John Sinclair was on a lot of those calls with us, so John would confirm what I'm saying. You and your staff did an outstanding job, Ken, to get us to this point. So on behalf of not only myself, but our members, I appreciate everything that you and your staff do. All right. All right. So our next guest speaker today is, and I'm going to reintroduce him again. He is Deputy Fire Chief Rich Elliott. He's a Wildland Ops Section Chief. He's also a member of our Wildland Fire Policy Committee, and he comes from the Kittitas Valley Fire Rescue in Washington State. So again, Rich, your topic that you will be discussing today is very timely. Again, I've been watching the headlines and even corresponding, conversing with some of my friends who are fire chiefs down in Florida on what they've been dealing with here in the past several weeks, so including this past week down in Southwest Florida. So Rich, I'm now going to turn the floor over to you, and you can talk to us about the upcoming wildland season and some of the challenges we're going to face during this pandemic.
Okay, thank you, Chief Ludwig. First of all, I'd like to start off by sort of talking about the mitigation efforts that have existed in sort of the ultimate congregate living facilities, and that being fire camp. As we respond to large incidents and incidents all the way up into the Type 1 incident management teams, we have in the past sort of accepted the fact that Camp Crud 3, 4, 5, 6 days into the incident typically starts moving through the camp. And it's not because the existing plans or efforts were necessarily in principle incorrect or inadequate, but the focus has not been on infectious diseases that are airborne. We focused a lot on the foodborne component of this, and obviously in the shadow of COVID-19, with both the perception and the reality of the downstream effects of COVID, we need to take a different look at this, both from the perspective of if we can put in place plans and contingencies, training, some basic equipment that our teams take to these incidents so that we don't communicate that disease at the incident and then bring that back to our communities. Obviously, there's a safety factor there, but the other piece to this is that the IAFC and the IAFC Wildland Policy Committee has been trying to sell state and federal partners on the concept that we are the force multiplier for wildland firefighting. In other words, actively, appropriately, efficiently integrating and engaging your local resources, which does exist in some parts of the country but does not in many, is an effective way to keep a lot of these incidents smaller. And so to get local agencies to participate, we needed to communicate out to our membership A, they're part of the responsibility in this effort, but also B, that there is planning so that the fire chiefs and leadership in agencies can make decisions, informed decisions about sort of how and when they want to fit into their regional or even their statewide wildland response. So again, we accept the fact that, or we have in the past sort of accepted the fact that airborne diseases do spread in incidents. Obviously, in 2020, we can't accept that. We have had limited focus on infectious disease as it relates to the logistical layout of a camp and the supplies that we ask the firefighters to bring with them, and adherence to the basic concepts of social distancing and sort of crew continuity. We know that the firefighters are at risk because they're coming to us with limited and low quality sleep. Obviously, we're living in crowded living conditions with limited sanitation, shower, and basically no quarantine processes in place when we begin to see infectious disease. Couple that with the buffet-style meal distribution and cafeteria-style dining, all with very limited hours, and we're basically packing everybody together and then add on the briefings that occur. So essentially, we have a disease, COVID-19, that appears to be fairly resilient, fairly easily spread in social settings, and we have a significant issue for our responders. Go next slide. So we're also aware this effort started 3-4 months ago with the Wildland Policy Committee. We started kicking this around, and at the time, the federal agencies, many of the regional plans were being assembled, local plans were being put together, and through the NASF, states were beginning to acknowledge that, hey, this is going to be an issue. And obviously, fire season is a little bit different in different parts of the country. In the West, we're sort of just starting that, but obviously in the South, Southeast, and Southwest, their fire seasons have either been ongoing or actually we're at the tail end of those. This led to a number, literally dozens of significant plans, all of which contain common elements. And so when we get a little further in the presentation here, what we're going to encourage our membership to do is, figure out what plan your region is going to be using and make sure that you're comfortable with it, make sure that you're setting your fire crews up to follow that plan. All of the common traits include that there are pre-response components. We just sort of laundry listed these. The logistics of fire camp and supporting a large fire incident is going to be more complicated and more difficult. Vendors, local community rules, just physically setting up the camp is going to be difficult, which means that meal component, and obviously firefighters are sort of driven by food within a couple of hours of response, is going to be an issue. And so we're recommending that the crews come stocked with, a reasonable amount of food for up to 72 hours, which will sort of take away that pressure on the incident. There's no saying that the incident won't have food up and running in the first 24 hours, but we want to count on the crews being self-sufficient for the first 72. PPE, basic PPE. Some of the regional plans, some of the local plans have the individual crews, wearing PPE from response through the duration of the incident. From the IAFC's, the Wildland Policy Committee, we're not sure that that's practical, but if that's the case, then you'll have to plan accordingly and take that PPE with you. There will be limited PPE available at the incidents to support responders. We're going to do most of this through social distancing. And screening is also going to be a component. We want people to screen their own crews coming into the incidents. One of the concerns that was raised early, whether it's credible or not, was on the contract crews and the concept that there may be a lot of economic pressure on the membership of some of the contract agencies to participate in wildland fire response because they may not have access to some of the unemployment benefits and kind of in the background. And so one of the things that's been built into the plan is essentially that crews are treated as a family. And if there is a positive or symptomatic person on a crew or with an engine or a hand crew, that entire crew is going to automatically move into quarantine. And so hopefully that'll kind of encourage that peer pressure component. And then finally, the most important thing that the fire chiefs can do for this system is to educate the responders that they are responsible to maintain a significant piece of this plan. And if they observe the rules, then they can expect the people around them to observe the rules. The check-in process, this is sort of chronological. Again, there will be an external screening. We're recommending type 3 incidents and above, the 2s and the 1s, that we have a screening process. So whether that be the safety officer, whether that be the logistics section chief, or a medical unit leader under logistics, there should be somebody at the incident working a screening process as the people check into the fire. We also want to streamline the check-in process. Most of the country is still not on a digital check-in process, which is for efficiency purposes. Aside from COVID-19, not a good idea, but we want people to have a very limited time or a limited opportunity for them to sort of gather in groups and check in. So we want to streamline that process. When food becomes available at incidents, we know that the prevalence of sort of prepackaged meals, maybe even to some distribution of an MRE or MRE type meal, is probably going to be part of the camp meal system. We're asking logistics to increase the amount of sanitation and hand washing facilities available and to partition the camps in a way that sort of keep groups separated. And we're going to have assigned sleeping areas for crews. In other words, engine crews going to all put their 4 tents all in one little location, and they're going to stay separated from the rest of the engines to the extent that that footprint will tolerate that. We're encouraging the IMTs to select larger sites for their camp locations so that they can accommodate this. And then obviously we're adding the infectious disease staff in some capacity even to the smaller teams. At operations, we're going to recommend very strongly to the IMTs that briefing be limited only to supervisory personnel, that they accommodate social distancing in the briefing process, and then that briefing is then passed on to the fire crews at their vehicles as they go back out onto the line. We'll do daily screening, or we're recommending that they provide for daily screening, and then during the demo process, again, screening and a streamlined process that keeps crews separated. One of the things that we're recommending and also notifying local health jurisdictions is that they should expect a phone call, a contact to be made as the incident is occurring in a local jurisdiction, whatever that local health jurisdiction. The IMT staff is responsible to get a hold of a local health official and say, hey, we're setting up a camp, here's where we're going to be located, invite them in to assist in the planning and such, but also to get a sense of what the local rules are. In Washington State, we see a significant amount of variation county to county, and in some cases they can be neighboring counties. It could be very limited issues in one county, but you travel over the county line and the situation is significantly worse with potentially more restrictions, and obviously we realize we're guests in those counties. We'll go to the next slide. So again, the primary focus and sort of one of the primary principles is that we want to treat the crews as family units. Some of the early planning efforts have encouraged the crew members to actually wear masks in vehicles. We know they're not going to wear them on the fire lines for communication and respiratory stress reasons. And we, from the IFC's perspective, we haven't gone to the point where we think that the mask wearing inside the vehicles is necessarily going to produce much of a benefit. So we're not recommending that, but that may be local policy. Individual firefighters, again, need to own their own infection control. They're responsible to wash their hands. They're responsible to use masks appropriately. They're responsible to maintain that social distancing. And, the concept of trying to police, anywhere from 100 to 1,500 firefighters who are otherwise focused on other things is just not going to be practical. We know we're going to have to remind people. We know there is going to be an enforcement component of this, but the basic principles of infectious disease management and related to COVID-19 in fire camps need to be embedded with the personnel who are responding to these incidents so that we're not having to sort of start from square one. The cloth or surgical masks obviously are going to be recommended and in many cases actually may be required in fire camp. So again, make our fire personnel very much aware of that. Make sure that they're going to the incident with a handful of those masks so that they can maintain that throughout the incident. Local health rules are going to apply, so that concept that the incident management team contact that local jurisdiction, get what the rules are. Keeping sick or at-risk individuals away from fire camps, and that's really that's the screening process that's going to occur as we respond. If anybody's at risk, have them sit this incident out. Have them do the quarantine, or hopefully not have to do isolation, but have them do that quarantine process internal in the community, and then when they're clear, then they can begin to participate again. And then acknowledging that those support resources that we may be used to, or the timeline that we're normally used to for logistics, is going to be difficult. There are going to be less contractors trying to do more things. Incidents are going to cost more, and there's going to be more competition for those resources. This assuming we have what is predicted to be a fairly significant fire season along the West Coast. Go to the next slide. So basically, we can't, we don't want to pretend that we can, for our memberships, eliminate the risk of COVID-19 transmission related to wildland fire response. It's simply not. There's too many variables. There's too many people coming together. But we feel that if the regional plans that are in place, if people understand those plans, if they have the supplies available to them, and specifically if they've been educated and very clear expectations have been set that when they respond, our expectation of our membership is that you're going to follow these plans, we believe we can mitigate out most of the risk. We know things will not go as planned. We know that there have been elements in the early planning efforts. Some of the Forest Service plans had components that just weren't practical or feasible. We know that wildland fires present risk to our communities, and we're going to have to balance that against the efforts that we're taking on behalf of COVID-19. The federal focus, or the feds have come out and said, we're going to do some things that's going to make it easier to keep some fires smaller. On the backside of that decision, there probably are going to be decisions made that it is not going to be potentially possible, or even from a risk-benefit standpoint, practical for us to fight some of the larger fires until we get the weather to change. So I think it's going to be one of those things where maybe we'll catch more of the incidents smaller, but the incidents that get larger may tax the system to the point where it just is not logistically possible adding in that COVID-19 risk to sort of operate the way we normally do, and we may have to wait a little bit longer for a break in weather or a break in the fuels. We want the incident management teams to get feedback. Hopefully that's constructive feedback that they can immediately turn around and then incorporate in it. So we see the plans evolving throughout the summer. We're sort of at the start of the traditional fire season on the West Coast and in the Southwest, but other parts of the country have already gone through this. We want those lessons learned to come back into the planning efforts, and we can make edits to these plans so that hopefully by July and August we have this down and we're doing the things that produce the highest return on our investment in terms of safety for our responders. So again, the conclusion is that and there's another slide coming after this that's going to talk about what we ask of you guys is we really want the leadership in your organizations to understand what is your regional plan. There is slight variation, although they substantially are the same. Know what your plan is, and then make that decision about what your agency's role is going to be in supporting your neighbors or maybe hosting large incidents in your community. Make sure your personnel know the parts of the plan that relate to the jobs that they're going to be doing and potentially to the jobs of the people that they're going to be working for, so they can understand when things aren't going the way they are, and give that feedback in a way that's going to potentially change the course of the incident for the better. We believe you should have policy, procedure language, or checklists for your personnel, because this is a little bit different, to make sure they go out the door with the things that they need to go out, and make sure that they have screened, and make sure they know what they're getting themselves into so that they can make decisions about their level of participation. The equipping your personnel and apparatus to support the plan, that's fairly straightforward. We've talked about the decision making, and then communicate that decision. If you're going to change what you're doing, it's going to be a little bit different this year than maybe the help that you've been able to provide for whatever reason. If you communicate that to your regional and to your state partners and your federal partners, then at that point that they at least understand that, hey, I may not be getting help in quite the same way, or it's going to take longer, or it's going to come in a slightly different form, or maybe I'm going to get more help than I am used to. Okay. And then finally, if your agency is possibly going to host an incident like this, having that conversation with your local health jurisdiction and making sure that they understand that there is a plan, that if this happens, that there is going to be communication between the incident management team, whoever has signed over the delegation of authority, and that local health jurisdiction to manage this risk inside of the community, sort of that incident within an incident. And have those conversations ahead of time, potentially supply them with versions of the plan. We sent, in Washington State, we sent the regional plan, and we sent sort of the IAFC's advice to the organizations, to the state health department, and then they pushed it back out to all their health jurisdictions. So that could be an example of getting the information out statewide, but nothing replaces that local connection. And last slide. So there's a couple. The CDC website is probably the strongest source of information right now. Again, we would strongly recommend that each of your agencies get a hold of your state forester, your federal partners, and make sure that you understand which of the regional plans has been selected, and then make sure that you're tied in. So I didn't list all those plans because there are literally triple digits for each of those links there. If you have any concerns or questions through the IAFC, either through Chief Sinclair or Chief Ludwig, you can get them back to the Wildland Policy Committee. If anybody has any suggestions about things we've left out or additional information that we should be looking at, please let us know. This is exactly what we're supposed to be here for. And I am very honored and appreciate the opportunity to speak. Thank you.
Well, thank you, Rich. That was very informative. Lots of information there. I like how they say nowadays that there is no more wildland season, no wildland fire season. There's just a wildland fire year now, and it seems to hold true so much. While you were speaking, I looked up at the government's website, the National Interagency Fire Center. And I was a little bit shocked to see there's 13 active wildland fires burning in the United States right now, and 8 of those being in Florida. And some of these are 1,000 acres. The one out in Arizona is 38,000 acres. Lots of challenges out there, and so what you provided today was quite informative. So I appreciate that.
Thank you, sir.
And also, I want to thank you for serving on our Wildland Policy Committee. Also, again. It's great to have people with such a knowledge base such as yours serving there and able to convey that information to others. So again, thank you for doing that.
Thank you. There's a lot of good people on that committee, so they did most of this work, but thank you.
They are. We are. We're blessed to have many wonderful people in this organization, in this association, who are serving our members and serving the fire service. So thank you so much again. So I want to thank all our panelists today, including our guest speaker, Deputy Fire Chief Rich Elliott. They all provided terrific and outstanding information. I also want to thank Chief Sinclair and Chief Pegram, who are chairing our different task forces for me. And finally, I want to thank our interim CEO, Rob Brown, and members of the IAFC staff, who I know undoubtedly are working many long hours and weekends during this pandemic. For those of you who are listening, if you have any questions, please email them to COVID19TF at IAFC.org. Again, that's COVID19TF at IAFC.org. As a reminder, we will not be doing this webinar next Monday in honor of Memorial Day. But please join us back on June 1st at 4 p.m. Eastern Standard Time, as we will again provide the latest information with new guest speakers. In order to be a participant, please go to IAFC.org to register. As I always say, and I say with my heart, I am honored to serve in this noble profession. with so many outstanding people who make a difference in their communities every day. Please join us on our webinar next week as we provide the latest updates and vital information. In the meantime, everyone, please stay safe. God bless you. Have a safe Memorial Day weekend, and may God bless the United States of America.